Hi everyone, my name is Samantha Schlaud, and today I'll be presenting our scoping review on machine learning for child oral health. So let's begin by explaining what is machine learning. So machine learning is a branch of data science. Specifically, it is an analysis method that gives computers the ability to learn without explicit human instruction. So how does machine learning work exactly? So we start with gathering information to train the machine learning model on. This is termed our training data. Relevant to dentistry, this could be radiographs, treatment records, experimental parameters, or photographs, just to name a few. A programmer then chooses a machine learning model to use, supplies the data, and then allows the model to find patterns or make predictions. This is then used on new data, and the result could be a diagnosis, treatment outcome, or disease prediction as examples. In dentistry, a significant amount of data is generated every day in our clinics. Machine learning is a tool that can be used to analyze these large volumes of data. Machine learning has the potential to assist dental professionals in detecting and diagnosing conditions more quickly and accurately, predicting outcomes, identifying those at risk, standardizing care, and supporting clinical findings. Additionally, patient education and understanding is at the core of our profession, and tools that can help support our findings give the opportunity to provide preventative and predictive dentistry and improve our standard of care overall. We know that the foundation for good oral health starts at a young age. Dental caries is the most common chronic disease in children and is considered a public health issue worldwide. This knowledge led us to focus on child oral health specifically. We aim to provide a map of the current evidence on machine learning and child oral health. We selected a scoping review to determine the coverage of this topic and to quantify the literature currently available. Eligible articles included those from any year that assessed a machine learning model for the diagnosis, prediction, or management of any oral health condition in children 0 to 9 years old. We use the World Health Organization definition in which children are defined as those less than 9 years of age. Literature reviews, conference papers, editorials, and abstracts were all excluded. The articles were required to be full-text original articles published in English. Our search was conducted on May 1st, 2023, and the following databases were used to search our key terms: PubMed, Cochrane Library, EBSCO Dentistry and Oral Science Source, Scopus, and Web of Science. And these databases were chosen because they encompass a wide range of scholarly articles, clinical trials, and research studies, all representing multiple fields, which enhances the diversity of sources included in this review. So to select our studies, we followed the guidelines of the PRISMA extension for scoping reviews. Our initial search identified 1,019 articles. Duplicates were then removed, and a screening process was then completed with regards to the title and abstract of each article, excluding those which were literature reviews or written in a language other than English. 165 articles were excluded during this screening phase. We then used our eligibility criteria to assess articles that were editorials, abstracts, conference papers, not related to machine learning or oral health, and not aimed at children less than 9. And this eligibility process excluded 588 articles. So after identification, screening, and eligibility criteria were all completed, there are a total of 31 articles included in this review. A predefined Excel spreadsheet was then created to record extracted data. Study characteristics we recorded included geographic location, study design, dental specialty involved, category model, and type of machine learning model used. The three categories of machine learning models could be prediction, diagnosis, or management of condition. Among our 31 articles included in the review, 12 of these were cross-sectional, 9 were cohort, 4 were clinical trial, and 1 was a descriptive survey. This figure here is showing us the global distribution of publications in child oral health in which machine learning was used. Globally, we found that a majority of the studies were from the region of the Americas, contributing 51.6% of our studies. This is then followed by regions of Asia with 38.7% of our studies. Lastly, we can see the European region contributed the least to the available literature, with only 9.7% of our studies. Furthermore, we categorize the countries by their economic classifications. Among the economic regions, we can see that high-income countries have been the biggest contributors to the categories of machine learning models, contributing to 71% of our studies. Upper middle income countries are next, contributing to 25.8% of our studies, and lower middle income countries the least, with only 3.2% of our studies. This figure here is now showing us the time trend of machine learning for diagnosis, management, and prediction across world economic regions and specific specialties. We found that machine learning is increasingly used for the prediction of conditions in pediatric and dental public health as time progresses. However, this was limited to work from high-income countries only. High-income countries have contributed the most to machine learning models through prediction and diagnosis of condition. Upper middle income countries have contributed to prediction and diagnosis, and lower middle income countries have only contributed to prediction. This next figure is showing us the different machine learning algorithms that have been used over time. So during the initial decade, shown here in blue, the neural network technique was the most preferred machine learning algorithm being used in research. It was then between 2011 and 2020 that, along with the algorithms used earlier, researchers started using deep learning, random forest, and other techniques such as regression. In the current decade, however, algorithms such as random forest and regression continue to rise, where newer techniques such as gradient boosting started to emerge rapidly. In this figure, we can see the different machine learning algorithms used according to each dental specialty. When analyzed by using dental specialty, deep learning, neural network, and clustering methods were commonly used across the board. On the other hand, algorithms such as natural language processing, ensemble methods, and linear discriminants were only used in pediatric dentistry. The aim of the scoping review was to map the current evidence on machine learning in child oral health. In summary, high-income countries and upper middle-income countries contributed the most publications, and prediction and diagnosis are the most common categories of machine learning models. Lastly, neural networks are the most preferred machine learning algorithm used over the years, while newer techniques such as gradient boosting have emerged in more recent years. Overall, machine learning algorithms hold great importance to the dental field, potentially assisting dental providers in predicting treatment outcomes, decision-making, treatment planning, and diagnosing conditions. However, low-middle-income countries are lacking publications, in contrast to literature available for high-income countries and upper-middle-income countries. A possible reason for this could be that these algorithms require large amounts of high-quality data for training, and this may be difficult to obtain in low-middle-income countries. Our review did have some possible limitations. We excluded articles that were not written in English, so this data does not include research published in other languages. Our scope is also narrowed from the literature available on the topic due to our age limitation. And it is also possible that despite the extensive literature search that incorporated multiple databases, some studies were missed in our search. And lastly, a literature review is a snapshot in time, only capturing information that was available when our initial search took place. Future research could be done to determine effective ways to make machine learning algorithms more accessible and accurate worldwide. This concludes my presentation, and I would like to thank Roseman University and Roseman Core. Thank you.